Lots of questions about testing, like, can a hospital test you without your knowledge? The Verify team working hard to make sure you have the facts. Investigative reporter Cheryl Mercedes took your questions to Harris County Health Authority Dr. Umair Shah.
The Texas hospitalization rate is going up.
False. The Texas hospitalization rate, and particularly what's happening in our community, is actually going down right now. But again, we want to see this sustainable over time before we enact any changes in our behaviors related to preventive measures.
You should take periodic COVID-19 tests, even if you have tested negative in an earlier test, just to make sure you are not asymptomatic.
True. The reason we're saying that individuals should consider getting retested is that, remember, you may be exposed once, test negative, but that doesn't mean it protects you from future exposure. So if you get exposed again, we want to make sure you also get tested again.
I can be given a COVID-19 antigen test without my knowledge and consent at the hospital.
False. When hospitals are testing for COVID-19, typically they will ask your authorization or permission before they engage in testing for COVID-19. Please be sure to check with your hospital when you are either admitted or when laboratory blood work is being drawn or samples are being taken, to ask what it is being taken for.
And tonight at 10, Cheryl continues her conversation with Dr. Shah. He will address the spread of misinformation concerning young people and COVID-19. Is there something you want us to look into? Email verify@khou.com or reach out on Facebook or Twitter.